All right, so go ahead and introduce yourself for me.
My name is Paul.
And how long have you been a patient here at Advanced Spinal Care with Dr. Lipinski?
About 2 years and 8 months.
Okay. So what initially brought you in to seek care here?
I had a lower back pain that I've had since probably 2000.
Oh, wow.
It's been on and off, just nothing bad, but a couple years ago it was really bad and I could hardly walk.
Oh, my goodness.
I've tried different chiropractors and nothing was working, and a friend referred me here to come here and be looked at.
Okay, so since you've tried different chiropractors, what did you think of that initial adjustment?
Well, the first time I did it, he did it. It worked. I felt better, but I was like, yeah, it's like maybe it's just working on its own. And then it was probably about 2 months later, it started having the pain again. Not as intense, but it was coming back. And I came in and he looked at me and did another adjustment, and it was gone the next day.
Wow.
So that made a believer of me.
So, and you've held pretty much outside of that. Has that happened when you've been at other chiropractors? Have you been able to hold your adjustment, or were you adjusted pretty much every time you went in?
I have. I mean, a lot of the chiropractors, they don't measure you and check you like he does here.
Right.
They just go in, they check your back, they adjust you, and they check a few things, but they don't use any other tools.
Right.
So when I first started having a problem, I had a chiropractor that did it the normal way to being a chiropractor, and he got me in the line. I mean, he really did. It felt good, but it was still always having to get that adjustment and go in there. And since I've been to here, it's been way better. It's just a lot less maintenance as far as that. I mean, obviously he checks me every month to make sure I stay in the line.
Right.
But yeah, this is definitely to me a better way to go.
Wonderful. So what does your back feel like now on a daily basis compared to what it felt like before?
It's probably pretty much close to a 0. I always mark
Wow.
a 1 on there because there's always a touch of pain somewhere along the way that you feel. So
Yeah.
I'm not a spring chicken anymore.
Well, and for those people that are watching the video, typically Dr. Lipinski will have the patient mark a 10 for the pain that they're in when they come in, and then a 1 would be minimal pain, or 0, no pain. So that's pretty impressive. No pain.
No pain, a lot of comfort.
That's great. That's great. Have you seen other things improve?
I don't know. I can't really tell that. I mean, I'm pretty active as it is, so
That's awesome.
maybe a little overweight, but still pretty busy. I stay
That's
pretty
great.
active all the time. So
That's great.
everything else just seems to function fine. I usually don't hardly have any problems.
Well, that's great. I'm so glad that this has helped that.
So am I.
Wonderful. Well, if you had friends that were looking into possibly trying NUCCA, what would you tell them?
Well, actually, I've got a few friends that I've tried to get to come to them to see them. I've got one at work right now, and actually, I have a flyer
Awesome.
right there.
Great.
So I'm going to take it to him. I showed it to him on YouTube. But
Yeah.
to get a little bit more, his right shoulder is lower than his left.
Okay.
So,
So posture-wise, it could help.
posture-wise.
It
Actually,
could
I
really
have
help.
another customer friend that brings his wife here, and I don't know exactly what else she has. She has to have like little seizures and that, and the doctors couldn't take care of it. And she started coming here. She hasn't had the problem.
Wow,
It was
that's
actually-
amazing.
Yeah, so
Wow. Well, great. Well, thank you so much for sharing your story.
thank you.
Appreciate it.